Vaginal dryness is a common yet often unspoken challenge that affects many women during menopause. While it can be difficult to discuss, understanding its causes, symptoms, and solutions is an empowering first step toward relief and improved quality of life. Let's explore the factors that contribute to vaginal dryness during menopause and the most effective ways to manage and treat it. Menopause is a natural phase in a woman's life, typically occurring between the ages of 45 and 55, when the ovaries gradually reduce their production of estrogen and progesterone. These hormones play vital roles in maintaining the health and function of the vaginal tissues. As hormone levels decline, a variety of physical changes may occur, and vaginal dryness is one of the most common and bothersome symptoms. Estrogen, in particular, is responsible for keeping the lining of the vagina thick, elastic, and well lubricated. When estrogen levels drop, the vaginal tissues can become thinner, less elastic, and drier. This condition is medically known as vaginal atrophy, or more recently, genitourinary syndrome of menopause, GSM. The reduction in natural lubrication can lead to discomfort, especially during sexual activity, and may also cause itching, burning, and even pain. But why does this happen? To understand the causes, it's important to consider the role of estrogen in the vaginal environment. Estrogen stimulates the production of glycogen in the vaginal cells, which is broken down into lactic acid by healthy bacteria called lactobacilli. This process helps maintain the vagina's normal acidity, creating a protective environment against infections. It also encourages the production of natural lubricating fluids. When less estrogen is available, this entire system is disrupted, leading to dryness and vulnerability. Beyond the hormonal changes of menopause, there are additional factors that can contribute to or worsen vaginal dryness. These include certain medications, particularly antihistamines, antidepressants, and some cancer treatments such as chemotherapy or radiation. Smoking can also reduce blood flow to vaginal tissues, exacerbating dryness. Stress and anxiety, which can accompany the menopause transition, may have physical effects that further impact vaginal moisture. Even insufficient sexual activity can contribute, since arousal and intercourse help maintain vaginal health by stimulating blood flow. Recognizing the symptoms of vaginal dryness is the first step. Common signs include a persistent feeling of dryness, burning, or soreness in the vaginal area. Some women may notice itching or irritation, and others may find intercourse uncomfortable or even painful, a condition known as dyspareunia. In some cases, vaginal dryness can also lead to minor bleeding after intercourse and an increased risk of urinary tract infections due to the thinning of the surrounding tissues. The impact of vaginal dryness can extend beyond physical discomfort. Many women experience feelings of frustration, embarrassment, or concern about their sexuality and their relationships. It's important to remember that these symptoms are normal and treatable, and seeking help is a sign of strength, not weakness. Fortunately, there are several effective solutions available. The choice of treatment depends on the severity of symptoms, any personal health considerations, and individual preferences. The most commonly used approaches can be grouped into non-hormonal and hormonal treatments. Non-hormonal solutions are often the first line of defense, especially for women with mild symptoms or those who may not be able to use hormone therapy for medical reasons. Over-the-counter vaginal moisturizers and lubricants are widely available and can provide immediate relief. Moisturizers, which are used regularly, help maintain hydration of the vaginal tissues, while lubricants are applied before sexual activity to reduce friction and discomfort. It's important to choose products that are fragrance-free and formulated specifically for vaginal use to avoid irritation. Lifestyle adjustments can also make a significant difference. Staying well hydrated, quitting smoking, and engaging in regular sexual activity or vaginal stimulation, whether alone or with a partner, can all help boost natural lubrication. Pelvic floor exercises, such as Kegels, may improve blood flow and support vaginal health. Wearing breathable cotton underwear and avoiding harsh soaps or douches can further reduce irritation. For women whose symptoms are more severe or who do not find adequate relief with non-hormonal options, hormone-based treatments may be recommended. Local estrogen therapy is a highly effective and safe treatment for most women experiencing menopause-related vaginal dryness. This therapy delivers small amounts of estrogen directly to the vaginal tissues via creams, tablets, or flexible rings. Because the hormone is applied locally, only minimal amounts enter the bloodstream, reducing the risk of systemic side effects. Local estrogen therapy works by restoring the thickness and elasticity of the vaginal lining, increasing natural lubrication, and improving the overall health of the vaginal tissues. Most women experience noticeable improvement within a few weeks. While generally considered safe, it's important to consult a healthcare provider before starting any hormone-based treatment to discuss potential risks and ensure it is appropriate for your individual health profile. For women who cannot or prefer not to use estrogen, other prescription options may be considered. One such option is ospemifene, an oral medication known as a selective estrogen receptor modulator, SERM. Ospemifene mimics some of the effects of estrogen in the vaginal tissues without affecting other parts of the body. Another newer option is prasterone, a vaginal insert that delivers a form of the hormone DHEA, which is converted into estrogen and androgens within the vaginal tissues. Emerging therapies, such as laser or radiofrequency treatments, have also shown promise in improving vaginal health by stimulating collagen production and tissue regeneration. However, more research is needed to fully understand their long-term safety and effectiveness, and these treatments are not suitable for everyone. In addition to medical treatments, open communication with your partner can make a significant difference. Discussing your symptoms and exploring new ways to maintain intimacy can help both partners adapt and continue to enjoy a fulfilling sexual relationship. Sometimes, working with a counselor or sex therapist can provide additional support, especially if vaginal dryness is affecting emotional well-being or relationship satisfaction. It's important to note that vaginal dryness is not a condition that women need to simply put up with. It is a common, treatable symptom of menopause, and effective solutions are available. If you are experiencing persistent dryness, discomfort, or changes in your sexual health, don't hesitate to reach out to your healthcare provider. A simple conversation can open the door to relief and renewed confidence. Preventing vaginal dryness, or minimizing its effects, is also possible with some proactive steps. Staying sexually active, even if it means using self-stimulation, helps maintain blood flow and tissue health. Prioritizing overall wellness through regular exercise, a balanced diet, and stress management supports hormonal balance and general well-being. Avoiding irritants, such as perfumed soaps, bubble baths, or tight synthetic clothing, can help protect sensitive tissues. Finally, keep in mind that every woman's experience with menopause is unique. What works for one person may not be the best solution for another. Patience, self-compassion, and a willingness to try different strategies are key. With the right information and support, women can navigate this stage of life with confidence and comfort. In summary, vaginal dryness during menopause is a common, manageable issue rooted in the natural decline of estrogen. It can cause discomfort, affect intimacy, and impact quality of life, but a wide variety of solutions are available. From lifestyle adjustments and over-the-counter products to local estrogen therapy and innovative treatments, relief is within reach. By understanding the causes, recognizing the symptoms, and seeking appropriate help, women can take control of their vaginal health and continue to thrive throughout and beyond menopause.